Today we are going to talk about the treatment of dirofilariasis or heartworm disease in dogs. In today's topic, we are going to talk about the pre-treatment evaluation, which is to categorize the patient into low risk and high risk categories, patient stabilization, which is to prepare the patient before the actual treatment to prevent any future complication, adulticidal therapy, which is the actual treatment for the heartworm disease, post-adulticidal therapy, which is to monitor the condition of the patient after the treatment, and the contraindication of treatments. Before actually treating a dog with a suspected heartworm disease, a thorough history taking is required to know whether the dog have had any heartworm disease treatment before. A physical examination is necessary to observe for any injuries that may affect the treatment in the future. A confirmatory antigen test, a blood count test, and a thoracic radiography scan to thoroughly assess the patient for any coexisting disease. After evaluation and risk assessment, the patient may be categorized into two categories, which are the low risk and high risk categories. Categorizing the patient into these two categories enable the vet to assess and rate the risk of any possible thromboembolism occurrence after the treatment.
Next, we move to patient stabilization. This is a procedure or step that being done to a high-risk dogs before an adulticide is administered. The dogs that exhibit significant clinical signs of heartworm disease should be stabilized first. This is because the therapy often leads to a worse pulmonary or cardiac signs as the worms die. The recent death of one or more adult worms result in the release of vasoreactive substances. These substances can cause inflammation, and the stabilization given to reduce the inflammation. Stabilizing treatment includes cage confinement, oxygen, corticosteroids, and doxycycline for 1 to 2 months before initiation of the split-dose methylarsomin treatment protocol. The use of doxycycline of the split-dose protocol lessens the adverse reaction to dying worms. Next. There are two aspects of pathology that need to give attention when stabilization being done. The first one is disease induced by inflammation in the lungs and pulmonary vasculature, and the second one is the signs of right-sided congestive heart failure. As mentioned before, corticosteroid medication is one of the treatments. In this procedure, prednisone used to reduce the parenchymal and arterial wall pathology. The dosage schedule is as follows. For the first and second week, 0.5 mg per kilogram of prednisone given for each 12 hours, and for third and fourth week, 0.5 mg per kilogram of prednisone given for every other day. Next.
Adulticidal therapy. The goal of any heartworm treatment are to improve the clinical conditions of the animal and to eliminate all life stages of the heartworm with minimal post-treatment complication. The only approved heartworm adulticide is melarsomin dihydrochloride. The active ingredient is arsenic, which kills both adult and immature heartworm. The dosage is 2.5 mg per kg, administered via deep intramuscular injection into the belly of epaxial lumbar muscles, which is between the third and the fifth lumbar vertebrae. Needle used for the injection is 22 gauge needle, which is 1 inch long for dogs that less than 10 kg or 1.5 inch long for dogs that more than 10 kg. Pressure at injection site is applied and maintained for about 5 minutes to prevent drug migration. A 3 doses alternate protocol injection can increase the overall efficacy values up to 99%, while two doses protocol only up to 90.8%, and it also can decrease complication rates. As you can see on the diagram number 1, the injections time interval between the first and second injections is at least at 1 month apart, while the second injection and the third injections is 24 hours apart. So all three injections are 2.5 milligram per kg.
Post-adulticidal therapy. This is given after the treatment of adulticidal medication. So first is that they will do restriction of exercise for 4 to 6 weeks for the dogs. This is to reduce pulmonary thromboembolism complication. But if the animal do suffer from severe pulmonary and thromboembolism, the veterinarian will do oxygen therapy, cage confinement, and administering a corticosteroid at an anti-inflammatory dosage. For example, prednisone at 1 milligram per kilogram per day and low doses of heparin 3 times daily. Next. Next is doing antigen testing that should be conducted 8 to 12 months after final dose of melastormine. If the test is found positive, the dogs will either do retreatment, which is 2 injections of melastormine with 24 hours apart, or non-arsenical approach, which is giving ivermectin or mesidectin at preventive dosage. This is preceded with 30 days of doxycycline therapy at 10 milligram per kilogram twice daily.
Then we talk about the contraindications when treating the Dirofilariasis in different animals. First, we see the melasomine is contraindicated in dogs with class 4 very severe, which means very severe heartworm disease, as the drug may cause simultaneous death of the microfilariae, which may lead to the elevated risk of pulmonary thromboembolism and potential anaphylactic-like reactions. This caused adulticide therapy in cats become more dangerous, as cats have relatively narrow blood vessels and heart compared to dogs. Also, melasomine is toxic to cats even at a dosage as low as 3.5 milligram per kg of body weight. Surgical therapies are highly dangerous in cats, as the feline juvenile vein have limited space which do not allow parasites to travel from the right heart chamber without tissue damage in most cases. The accidental rupture of adult worms during surgical intervention may lead to the release of parasite products and anaphylactic shock, followed by the cat death. Diuretics are also contraindicated as aspirin and other non-steroidal anti-inflammatory drugs in treating the cat. Surgical for ferrous, adulticide therapy is not acceptable in most cases, as the same reason with in the cat's treatment. Chemotherapy is not recommended in human Dirofilariasis treatment, as surgical usually take place.